Thank you very much. Namaste to everyone. Since we don't shake hands these days, we have to make do with Namaste only. So this is about what we did in Bhilwara and how we were able to manage and contain the virus in a city which was sitting on the verge of explosion. In fact, I remember 2 days after the first cases appeared in a hospital there, one foreign media channel said Bhilwara is going to be the next Italy, and that hurt. And as a proud Indian, we said no, we will not let it be Italy, and we will be able to contain this to the extent possible. So we put our best foot forward. I don't know how many of you are familiar with the working of the government, but governments usually put their best foot forward in the times of crisis. And in the times of crisis, we coalesce together. There is excellent, tremendous coordination, and we work almost 24/7 to put things in order. I hope we work the same during the normal times as well. Just to put things in perspective, we are the largest state in the country in terms of geographical area, and we are a big tourist destination, as probably everyone knows. The first corona patient was reported in Rajasthan in on March the 2nd, when we had a group of Italian tourists who were traveling all over Rajasthan. And when they landed back in Jaipur to travel further back to Delhi and to Italy, they discovered some discomfort and they were taken to hospital. And we realized that this is a corona patient. Just to again put things in perspective in terms of our testing capacities and health infrastructure, at that time we didn't have any testing lab in Rajasthan. So I remember I had to fight with the samples were sent to National Institute of Virology, Pune. And then we got the report 2 days later. But as we speak, we can test 10,000 samples per day in Rajasthan. Because we quickly upgraded our infrastructure. And if you have been reading newspapers, this is all about testing, tracing, and treating. So if you have to manage corona, you have to trace the patients, you have to test the patients, and you have to treat them well so that they recover and go back home. Coming back to Bhilwara, Bhilwara is one of our 33 districts, and the area is about 10,000 square kilometers. It has 6 municipalities, so there is a scattering of small towns. And Bhilwara is an industrial town. You must have heard of all the textiles and everything being done there. And in terms of the urban part, the number of wards is about 50 plus. About 73,000 houses in the urban conglomeration. I'm saying this not to bore you, but to tell you that I remember I was sitting with my team in my office. It was 9:30, and we got the message that there are these 2 doctors who have become positive, and one was in my public hospital and one was a private hospital. We really got alarmed because it was not a scattered tourist case who had come back from Delhi or a foreign country, so we could just contain it. When you hear that a doctor has turned positive, then you suddenly realize the enormity of the problem, because a doctor is working very closely with other healthcare workers. A doctor is seeing patients not only at the hospital but also at his home. And this is a city hospital, and people are coming to them from nearby villages, nearby small towns. So we had to quickly get hold of the situation. And I spoke to the district collector. I said, you have to put the city under locks. And so the key is we are sitting in the state capital. We work for the government. But I think the key is how quickly the district administration responds to your nudging and your guidance. And that is how I must give a lot of credit to the district administration, that they quickly responded to it and they quickly took a lot of action. I think the key of Bhilwara model, which I coined that phrase, ruthless containment. Now, this is a virus which is the R naught, the factor is 2.6, and it can spread very quickly. So the challenge is, if anybody has to contain, it's not just Bhilwara, any city which has been able to contain it, there are only two set of formulae. One is you act quickly and you act aggressively. I mean, this is not the time for niceties. This is not the time for people to let the people feel good. This is the time to be aggressive and to act early. Any city that has acted early and aggressively has succeeded. It's globally true. It's not just for India. Now, so when you see that there is a hospital and a set of patients who are scattered across the district. So not only you have to do containment, but you have to do a lot of surveillance. So a lot of credit should go to our chief minister who had launched this program called Nirogi Rajasthan in December 2019. It was a part of his first anniversary of his government, and because he is very proactive on healthcare, and he told us that you have to take a lot of steps for both preventive and curative healthcare. So we launched this program in December, and one of the main pillars of this program was that we have to go to every citizen in Rajasthan and develop a health record for him so that he can have a health record. So we were our teams, which is our ASHA workers, ANMs, our nursing staff, our doctors, and care administrators, because we had to go full hog in March, and we had to touch every citizen of Rajasthan to get their healthcare information. And suddenly this thing happened. So all that training for Nirogi Rajasthan, as it was called, came very handy to our teams, and we quickly deployed these teams in various villages. We got, in fact, just to give you some statistics, which is probably on the PowerPoint also, teams which spread across the Bhilwara district, which went to every symptoms. These are called ILI symptoms, which is influenza-like illness. We took the record of everybody, khasi, zukam, bukhar tha, and then we made a line listing of them. We took their phone numbers, and we kept whether because they were potential corona patients, and unless you track and talk to them again and again, across India is many of the patients are asymptomatic. So even if you are checking for influenza-like symptoms or what is called respiratory illness, you also have to keep in mind that many of the patients will not show symptoms till a later date. So what do? You do something like what Sherlock. You see a positive patient, and then you see who are the people living in the vicinity, who is this guy coming into contact or likely to have into contact with him, and then you track and trace them and test them. Now, a lot of technology was also used. I think in my introduction it was mentioned. So we like technology. Rajasthan is pretty advanced in terms of using technology, government systems. What we did was we got the permission from Ministry of Home Affairs to get the call data record of anybody who tests. So suppose you're tested positive today. So we go minus 15 days and we check through your call data records, through the towers where you have been, where all did you go over the last 15 days, and who all came into your contact, meaning which part of the cities you were in and where did you go. They are called super spreaders. They are people like the milk vendors, the vegetable vendors, the people at the corner store who are likely to come into contact with many other people. So you quickly get hold of who was this guy meeting, who was a super spreader. Go and track them, test them. So the idea was to quickly form a containment policy, containment plan, and divide the city into various parts: the real containment zone, the hot zone, the buffer zone, and do both containment and surveillance in parallel. And that is how we managed to contain this problem. And as we speak, Bhilwara doesn't have. I have the table as on 3 p.m. today, and Bhilwara only has 5 active cases, and these 2 they were travelers from Delhi, and I'm very sure they'll be discharged from hospital soon. So Bhilwara became COVID-free some 3-4 days back. We had some new travelers who came to the city, and now they are under hospitalization and they'll be cured. Because we had to isolate people who were likely to be positive from people who were See the numbers. As on date, we have tested about 9,453 people just in Bhilwara district. Rajasthan has been ahead in the country in testing, and we have tested more than 1,15,000 people in the state. So when it comes to, in terms of population ratio, for example, tests done per million of population, we are probably the highest in the country, only behind, I think, Delhi, a small city, and they have very good health infrastructure. We are basically a rural state, and we have challenges in terms of distances, in terms of delivery of services, in terms of our capabilities. But all credit goes to our decision makers like the Honorable Chief Minister, who quickly asked us to ramp the infrastructure, especially in terms of testing. So from zero, we are today able to test 9 to 10,000 every day. And he has given us a target that by the end of May, we should be able to test 25,000 RT-PCR, which is a confirmatory test for by 30th May 2020, which we are working on. We are procuring new machines. We are getting new microbiologists. So he wants that every district should have this testing facility, because when samples are transported over districts, they get delayed. And if I am tested today and my result is coming 2 days later, there are a lot of challenges in this. There's a huge risk that I don't know whether I'm negative or positive. Do I move? Do I stay at home? And then my discomfort as to, for 2 days, I'm in this unknown territory. I'm very uncomfortable. So I think the idea is to reduce the backlog of testing and have the test results available on the same day. In terms of some other things where we have done well is our death rate, which is number of deaths out of total positive detected, is probably one of the lowest in the country. It's 2.1%. The country's average is more than 3%. In terms of recovery rate, how many people test positive and how many recover, we are almost at 41%. And there's a lot of research going on at our premier hospital, which is SMS Hospital, Jaipur. And I was just, before coming to this webinar, I was talking to the principal, and our genomic sequencing can be done, and we have traced the virus to a specific point in Delhi, and which of course we will do more study and release it later. So now, when you have an epidemic like COVID, what do you do for other health services? That is also important, because when you are containing something like Bhilwara, but people are not only suffering from COVID, they are suffering from other ailments, kidney ailments, heart ailments. So what do? So what we did is, another thing which was done digitally was, we have this huge database of Ayushman Bharat patients. We have 1.1 crore families in Rajasthan who are beneficiaries of, and I'm talking families, not people, of Ayushman Bharat program. So you dig into the database and you see in the hot spots who are the people in Ayushman Bharat database who are living in these curfew zones, containment zones, and then you check for people who are more than 60 years and who also have these other comorbid conditions. So, for example, if I'm in Ramganj in Jaipur, which is my big hotspot, and I'm 65 years and I went for a kidney treatment in Ayushman Bharat, then I get quickly identified by my digital people. Then it's given to the health team. They go to his house, ask his condition again, and then take care of him, because the idea is to save lives. So you check for vulnerabilities so that people don't either die for other illnesses, or they don't become, those conditions don't become comorbid conditions for COVID-19. So that has been done successfully. Since we have curfew in about 100 police stations in Rajasthan, people with other OPD requirements, which is outpatient requirements, where do they go? So we have deployed 450 mobile vans with doctors, nurses, and medicines. They are stationed near curfew areas and many other areas, because people these days have difficulty in transportation. So they are stationed there. And I get this information at 5 p.m. every day. I just got the information that today they were able to provide services and medicines to about 23,000 people across the state. So that's another thing that has been done. What else did we do? we keep doing things because it's an evolving situation, it's an evolving problem, and unless you act early, as I said, and aggressively, you will not be able to contain it. India overall has done very well, whether it's implementation of lockdown, whether it's implementation of the plan to contain. And if you compare data with other countries, developed countries with much, much superior health infrastructure, would see that a number of positive patients, number of deaths, and number of people requiring critical care like ventilators and oxygen support is very, 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 very low compared to other countries, especially when you take the denominator as a population. This is my story. I don't know whether it was very coherent, but if you have any questions, I'm ready to take them. Thank you very much.
Just one little clarification I wanted. Have you evolved any policy for checking health workers? The health workers who are handling the COVID patients, is the government of Rajasthan having a policy to periodically check the positive for them? So what periodicity so that they don't become a carrier and then transmit to the other people? So what is your policy on that?
So that's a very good question. We are a huge risk. They are in long and prolonged contact with the patients, and they are visiting the wards. So first is to protect them. So you give them the best possible protective equipment. You give them the best possible masks, PPEs, and you fumigate and sanitize the environment in which they work. Then also, like you said, we test them periodically. We also have given heavy insurance to them that in case of an adverse eventuality, they get duly compensated. They have also been given financial incentives. And about a month back, as ICMR prescribed, we've also given the hydroxychloroquine treatment to all our frontline healthcare workers from the government side. So the idea is they are frontline warriors. They are taking the risk every day, and we have succeeded because of them only. So it's our job to protect them.
Right. Thank you very much. Now, how do you open up the business and the economic the front in the state as the things are getting eased now? The lockdown may be relaxed. So, have you made your strategies to balance the business vis-a-vis the healthcare?
Yes. So we made the strategy. If you can see this, this is Rajasthan. If you see there are different colors here, there is red zones, the orange zones, and the green zones. And we did an exercise this morning as per the Ministry of Health Affairs directions that if there is a district which is red, but there are no cases outside the municipal area for last 20 days, then you can open the non-municipal area, which is the rural part. And if you realize most of the industries, including those in Bhilwara, are located outside the municipal areas. So we will be gradually opening them up. Some are already open, some construction activities already going on, road construction is on. The work at our Narega site, which is Mahatma Gandhi National Rural Employment Guarantee, is being done because we realize that unless economy has taken a big hit, so unless you start giving money in the hands of people, unless people start spending money, the engine of the economy will not get revved again. So it's gradually started. There will be a further fillip from Monday, which is May 4th, which is the lockdown 3.0. And I think gradually we had a special committee headed by a former Finance Secretary of India who has given us a 100-point plan as to how to quickly accelerate new economic activity in the state.
Last question from my side is migrant workers. There are many people who have come across from other states to Rajasthan. So how is the government of Rajasthan taking care of these migrant workers?
We first quickly identified them, put them in camps, and we took care of them. We put some cash in their hands. We gave them food also. Rajasthan is known for its culture of bhamasha and the dan data culture. So many NGOs and many charitable organizations come forward to support. Government also pitched in. So They were duly taken care of, but as we go and talk to them, they just don't want the food and facilities. They want to go home. So we have a dedicated number, which is 181, where they called and registered. We were the first state probably to register all of them. So we have about 4.5 lakh people who wanted to go out to their respective states, and about 10 lakh people who wanted to come into Rajasthan back. So that is done. And last night, trains have also started. The first train from Jaipur to Patna started at 12:20 midnight last night. So people are traveling. A lot of people have been transported through buses. So we take them to our borders through our buses, and then the receiving state like Uttar Pradesh, Madhya Pradesh, Gujarat, and others, they send their buses and then they take them home. So it is going on smoothly. Of course, there is a lot of it's an emotional and psychological issue because you've not been able to go home for 30 days. There is no work. So of course, these are stressful times. But I think people have coped very well in this.
I have one question to you. How do you handle the
Yes.
asymptomatic patients here?
So the only way is to, one is random sampling. So if you want to check prevalence, so you pick up the samples randomly. For example, in Ramganj area, we divided it into 30 zones. In fact, I have the map somewhere here. And then we divided into 30 clusters and picked up 30 samples from each. So we had these 900 samples which we tested randomly, and we got a prevalence of about 5%, which is big. So then we changed our strategy in that area, and we said, let's now focus on saving lives. If you see, the structure of the problem is different in Bhilwara and in Jaipur walled city. The way people engage with themselves, the way people live in very close proximity. So, for example, if you tell the citizens in Bhilwara that you maintain social distancing, it is possible there because it's a little spread city. But if you tell the people in either Chandni Chowk or Ramganj that you maintain social distance, so the houses are so small, it is practically not possible. So you have to change your strategy there because the structure of the problem is different. So you have to quickly, keep thinking and evolve new strategies to meet these new challenges.
So, so you must be generating a huge number of data, like by analyzing the samples and all that.
Oh yes.
So, are you maintaining the database, or you are digitizing the data so somebody can do research later on that one?
Oh, we are already doing research. We have people from the Poverty Action Lab of MIT USA. We have people from Harvard School of Public Health working with us. We have a local, very good institution called Indian Institute of Health Management Research, who's constantly working with us. So every day we analyze data, we develop graphs, and in fact, after this webinar, when I go every day, the Chief Minister reviews in the evening, and then we present this data to him as to how things are evolving, how things are changing, in terms of mortality rate compared to other states, how is the prevalence increasing, is our curve flattening or not. So all that is done every day.
When this COVID thing was all negative, things were flowing in from all directions. Bhilwara gave us the first hope, and today we are hearing the Bhilwara hero. Right to call you hero. Bhilwara gave us the first hope when this COVID thing was happening. When it started to happen and all negative things were happening from, and Bhilwara gave us immediate hope. And today we are welcoming the hero of Bhilwara. No, Bhilwara may be a success story, but even if we talk about other parts of Rajasthan like Jodhpur or Jaipur, this Bhilwara model did not succeed that much as Bhilwara promised initially. What can be the socio-economic reasons for that? I can understand there could have been some administrative challenges, but were there some socio-economic reasons for that? That is the question that has been asked by two of our attendees, Amit Jain and Dr. Nalini Ramawat, that it did not succeed in places like Jaipur and Jodhpur.
So as I said, every place, the structure and the character and the nature of the property where people live very close by, their cultural engagement, their social engagement is customarily different. So you evolve a different strategy. You quickly, lock down the area. Then you maybe pick up people from there and put them in isolation or quarantine centers. And then you also take care of, you take help of religious leaders. You take help of NGOs, because a lot of it depends on communication. It is not just testing and medicines. I think 50% of this problem depends on how you communicate with the community and society on various issues like prevention, social distancing. So that is why we'll be able. That's why the curve is flattening, and we are not getting as many cases now. So maybe we'll be able to contain it better.
How have you prepared yourself for a situation, for the recurrence of this pandemic in your own area?
I think, as you must be reading, in this virus is not going to go soon. So we have to change the way we live, the way we engage socially, and we have to, since economic activity has to start, and the normal life has to start. So we have to have a new strategy of how to live with the virus, and always wearing a mask. So I'm not wearing because I'm sitting at home, but the moment I step outside, I wear a mask. And then small things like not shaking hands and doing the namaste, and taking a lot of preventive steps. Taking the moment you have influenza-like symptoms, check yourself, go to the hospital, get yourself checked. So we have to change our behavioral pattern, because this virus is going to stay for a while, and we have to change our lifestyle. That is the only way to prepare. The other side is the curative part. This was the preventive part. On the curative side, your hospital infrastructure requires to be augmented, which has actually happened not only in Rajasthan but all across the country over the last couple of months. And you strengthen your not only physical infrastructure, prepare your human resources also for meeting this. So it's a very comprehensive strategy that you require to follow.
Dr. Rana, there's one more question from Ranveer Kumar Dagan. He's is that there were some media reports that some new cases of corona have been reported. Can we still say Bhilwara model?
Of course. See, I think first of all, you cannot wipe out new cases, because we are a society where people have mobility. So if there's a person who traveled, from Delhi to Bhilwara, and he's got the virus, and he, starts living or working, and he gets tested positive. So heavens are not going to fall. The model is, the moment you identify a case, how you handle the situation. That's the Bhilwara model. And I think the crux is in that phrase called ruthless containment. So the moment you pick up just one case, maybe, you quickly, fire, from all vantage points, and you quickly contain the situation. That's the strategy. As I said earlier, act early, act aggressively. Don't let it simmer. And the key critical success factor is in implementation. I mean, there's no rocket science in handling an epidemic. Everybody knows what is to be done, but the crux is how you do it, and that is true for everything in life. You can make good plans, but if you're not able to execute it well, this is for your students. You can dream big, you can make big plans, but unless you work hard and have a very smart implementation, execution, then only you will succeed. Planning is different, but implementing it the right way, implementing with all integrity, all sincerity, a lot of hard work. I think that's what should be taken out of this Bhilwara model for the students who have a huge career ahead of themselves.
When we compare our situation with the global situation, say we compare ourselves with what happened in USA, we were very prompt in enforcing lockdown, which state of New York did not do, and they have suffered. Now, since you are an administrator, what must have happened in the administrative level in USA, which they did not think it deemed necessary to enforce lockdown, which we have in our country are very administrative reasons
I
that
think
have been there not to enforce the lockdown there, which we successfully did here?
it's not for administration or any government, because there are two competing requirements: lead a normal life and engage in economic activities and say, you know, everything's fine, nobody's going to die. The other is whether you want to contain it now, whether you want a complete lockdown. So I think some countries have adopted the second strategy. They said, no, we are not going to let this virus spread. We are going to, you know, totally control it. And I think those countries have succeeded. But as you see the models of Singapore, so one has to be careful that you cannot let it go, because after reaching a big zero, after reaching a zero situation of no patients, Singapore suddenly has 10,000 patients, because they didn't have a very comprehensive strategy, and they should have, I think, extended the lockdown. And they have two different sets of populations. One is the middle class and above, which is living in nice houses where you can maintain social distance and do testing and healthcare. But places like Little India and other places where the laborers lived, they didn't pay adequate attention to the healthcare and the management of COVID there. So suddenly it erupted again. So we have to ensure that we should not be indulging in little niceties of comfort. If the lockdown is working, let's continue it. But the challenge is economic activity is also required. So that's where the wisdom and the strategy of the government comes into picture. What is that judicious mix of containment and releasing economic activity? What is that mix? Where is that balancing point? So anybody who's been able to decide that, although nobody knows, there is no precedence here, this is a new challenge, but anybody who comes close to the optimal, he's going to succeed. That's my 2 cents.
That the immediate precedence, if at all we have any, is goes back to 1918, more than 100 years. We had a similar kind of a situation. As an administrator, what would be your message to the society, to the medical fraternity, and to the scientists involved in developing solutions to fight this challenge? What would be your message to them, so that we prepare ourselves adequately for the future?
So my message is, people, science has progressed so much, and they were, they are already performing trials on plasma therapy. There's a lot of talk about vaccine being developed in Oxford and other places, and even in so many Indian companies are experimenting. A lot of startups are working on the vaccine. So I think the time it takes will be reduced vastly. I mean, I personally think we'll have a vaccine by August, September, which used to take, maybe 2 years, 1.5 years, or maybe 10 years. So I think the message is there. Everybody knows this is a big challenge. And if we have to put our minds together, we'll get a solution quickly. So my message in general is, don't take anything lightly. Problems can emerge. But if you are, sincere, if you are committed, if you are focused, then you will be able to meet any challenge, come whatever may.